Hey to all those seeking vibrant health. It's Dr. Rachel Northern here at Johnsburg Chiropractic and Wellness Center in Johnsburg. And today we're talking about babies and chiropractic. I have a pediatric certification. I'm going to talk about what that entails at the end. But a lot of people don't realize babies can be adjusted too. A lot of people are already scared of chiropractic. I got a lot of new patients that come in are nervous to see me as adults. A lot of people don't realize how we can translate that to babies. We're very safe, we're very gentle, and I'm going to go into some reasons why babies should be adjusted and checked as well. So here we go. So first off, chiropractic is beneficial to all peoples, of all, everybody, and even there's chiropractic for animals as well too. So if you didn't know that, there's chiropractors that adjust horses and dogs and etc. But let's just focus on here in our office. We work on people. So babies are just awesome to work with, and I always just like to treat patients through, if I can get them before pregnancy would be great. I have a lot of people enter in chiropractic because of during pregnancy, maybe get some sciatic, some back pain, some issues, and then I'd like to see them all the way through delivery. And then I always say, can I just do a complimentary check? Not all babies need to be adjusted right after birth or a couple days after birth, but I like to check them to make sure, because the nervous system goes through the spine and through the body, and we want to make sure that it's optimally functioning. So we're going to talk about that. But there's some really good benefits for helping babies. So first off, we don't do a traditional adjustment with babies. It's very safe. It's very gentle. It's sometimes just really gentle movements, sometimes just little tiny tapping with maybe my finger, motioning maybe in the back, some maybe rotation. And what's nice is, like, say you had, the pressure we use is like if you had a tomato and you just kind of make a little dimple into a tomato. That's how much pressure us chiropractors use generally when we're working with babies. They're so flexible and they're so growing, and they actually correct fairly easily. So, the purpose is to improve like the spinal alignment, the hip alignment, the shoulder alignment. As delivery happens, the baby drops down and head goes through, the shoulder comes out, and it's like this whole process. And a lot of times the shoulder will get out of alignment. I catch that a lot on some babies. That can interfere with maybe crawling in the future. So there's things that we could check that we want to make sure that everything's good. We want to alleviate discomfort. Also just making sure that nervous system's able to adapt and thrive. So, like I said, we're very safe. We're very specific, especially with babies. We want, all chiropractors should be very specific, but even so, when we're looking at babies, just making sure that we're looking at the things that we need to. And that's part of my pediatric training, is that we actually go through extensive training. I had, I think, a couple of years to go through the program to make sure I got all the aspects of dealing with babies in all different stages. And common misconception is that, like I said, we're really harsh. We're not. We're not going to go twisting this baby really hard, or do like some people talk about the side pressure or popping. We don't do that. A lot of times it's like a little tiny whoop, and it's like feels like a little click when I have movements. It's really awesome. I already talked about this. We want to make sure. This is usually how babies usually enter my office though. So we have babies born, parents go a couple weeks without sleeping because baby doesn't seem to be calming down. They feed them, they change their diaper, they're up at all hours of the night, and there's a breaking point when the parents are like, I will do anything to make my baby stop crying, and they kind of Google that or whatever. They find a way into my office, because there's a lot of things, a lot of studies coming out with colic and discomfort of babies, so they bring them in, and then we evaluate them. And a lot of times colicky babies could be a multitude of things. Sometimes it could be upper cervical, where their neck is off. It could be their mid-back. A lot of times if they're laying on, like you put them down on their back and they arch up, that's telling me they're trying to communicate this uncomfortable. That's uncomfortable laying on my back. Whereas us talking adults can say, hey, when I do this, it hurts. Babies have to listen to their body language. You got to see what's going on with them. So that's what we do as chiropractors. We observe, see what different movements cause discomfort. If I touch them in a certain way and they cry, a lot of times I'll show the dads and the moms, I'll like, okay, they're fine. I touch them there, they cry. There's something going on there. And then we try to, correct that area. And then I touch it again and they're like happy and they don't cry anymore. So I can prove a lot of times that we're doing what we're doing as chiropractors, taking the tension off the nervous system. So, also colic is sometimes related to gassiness if they're not pooping. Unfortunately, a lot of medical doctors say, oh, a baby can go without pooping 5 to 7 days. That is so wrong, especially if they're nursing babies or breast milk fed babies, because those babies should be having multiple poops a day. They should be clearing those toxins out. That is not good, not healthy. So a lot of times that's related to the pelvis and the low back. I find dysfunction, subluxation in those areas, and we do corrections there. And it's amazing because they're pooping regularly after we do those corrections. So there is some really great releases that happen, and we see symptoms change pretty quickly when we start dealing with babies. Another one that I get patients coming in is chronic ear infections. They maybe had their baby on multiple antibiotics over the course of the first year of their life. Unfortunately, these kids usually come in a little bit later, several months in, maybe a year or two. They've already been through several rounds of antibiotics because nobody really thinks about why is the ear infection happening in the first place. They're going to keep throwing these antibiotics to kill the bacteria in the middle ear. But what is actually happening is the head maybe is kinked a little bit, or the neck is subluxated at the upper cervical. That tube in the back of the ear, inside the ear, supposed to drain to the back of the throat, is having trouble draining, causes a little petri dish in the ear, and it's just perfect area for bacteria to grow. And they just keep killing the bacteria, but not fixing the cause of the problem. So there's a multitude of patients I've had come in, we start adjusting, all of a sudden all the ear infections don't happen anymore because we corrected the cause of the problem in the first place. So that is why also the nervous system, the immune system is really connected to that upper cervical as well. So the immune system can properly send in the reinforcements to clean up that area as well. All the good guys that we have. Sleep, again, we talked about, I've had a lot of times I adjust babies and I always warn the patient, or the parents, the parent of the patient, they're probably going to sleep a little bit longer. I warn them because I've had people panic, like, oh my gosh, they slept for like several hours after they get adjusted. I'm like, that's good. It's kind of like we set the immune system and the nervous system, reset it, and the body's like, okay, we're going to heal and recharge. And so they kind of go into a little bit longer sleep to reset that body and heal. And it's pretty awesome. So it's great. A lot of patients notice that the babies sleep better after starting to get adjustment, especially after the day after adjustment, they notice that. So definitely we're taking tension off the nervous system. And actually I have a lot of adults that have that same experience. They come in there like, oh, I always sleep so good the night after adjustment, or like right after. I have patients that know they have to have the end of the day adjustment because they're like, oh, if I get it in the morning, I'm so like kind of relaxed the whole day, it's hard for me to work. So they know the end of the day, they know they're going to sleep. They know that we reset like kind of that sympathetic, parasympathetic, rest and digest and decrease stress. And so we do that with babies as well. So what I'm getting a lot of right now, I have a lactation consultant that's been sending me a lot of babies in because of the tongue tie, because they have a lot of connective tissue that needs to be worked on, and it's causing trouble with latching on the breast or bottle feeding. Other things also associated, that tension in the body. She's noticing like torticollis. Maybe the kid doesn't want to turn to one side. So she's noticing these things, and she identifies that this is something that a chiropractor can help with, whether me or a lot of times I also, if they're really kind of a complicated, like there's a lot of rotation going on, I'll send them to a craniosacral specialist as well that works with babies. And it's great because after a couple of treatments, you can gradually see and sometimes drastically see changes with these babies. And unfortunately, on the medical side, a lot of times they'll grow out of it. And there's been some studies, research out there, like we have problems with tongue tie all the way into adult years where people are going to get releases later in life because they've had this chronic tension, and it's amazing how they heal. So if we can catch them as early as possible and help with those, that's great. I've had a couple of patients that come in that want to go and get like these kind of tongue ties and cheek ties and things released. and I can evaluate to see if that's actually necessary, because sometimes just with doing some connective tissue work and doing the adjustments, they don't actually need that. And sometimes it's like, yes, they're pretty severe, and then we want to get those addressed and go to the proper channels for that, proper places. So we want to make sure babies are able to move like they should. They should be symmetrical. So if you notice babies always tilting, always in the car seat to one side, always laying to the one side in the crib, if you notice like one arm always wants to come up, or like you're changing the diaper, if you notice one hip doesn't want to move as well, those are some things to pay attention to with babies. Also, another thing I do as a chiropractor is I want to make sure they're hitting their developmental milestones. So when patients come in, I want to see if they're hitting, they're bringing their hand to their mouth, they're tracking their eye with things. So I look at each stage and try to look up and make sure that they are developing like they should, because unfortunately we've had some changes in the recommendations. They've actually pushed back a bunch of these milestones in the last year or so in recommendations. There's a lot of conspiracies why. I'm just saying, with the chiropractic babies, they're still on the old milestones. They're still hitting those earlier than what they're noticing in the general population. So we have a lot of things changing, and I want to make sure we give babies the most benefit of just operating in our society these days. Obviously, I also give parents advice on maybe some physical therapy movements and things like that. If I think they need a little bit more physical therapy, I'll recommend that as well. So, and one thing people don't think about is just how your nervous system interacts with your immune system. So there's a lot of research on that, how the nervous system tells the immune system, hey, we need to increase those white blood cells. Hey, we need to pay attention. Hey, this is not good over here. We got an invader. Let's get that up. So let's get, so those kind of things is great, because that research is out where people under chiropractic are actually healthier, less colds, less flus, or if they do get the flu, less time being sick. So let's keep up that. And one slide I just put in here extra is other considerations. I've had a lot of, unfortunately, the mainstream out there, advertisement, there's a lot of lotions and soaps, and particularly there's been awareness of lavender. I don't know if it's like the real lavender or if it's like some synthetically made smelling lavender, but any babies, I tell people now, just if you're under 3 months or younger, 3 months and younger, please just try to stick with really basic soap and water. Make sure you can read the label, and if you want to do any lotion stuff, maybe stick with like coconut oil and things more natural, because we've gotten so many chemicals in all our products out there, these mass produced, and actually there's some aware consideration out there saying that maybe these lavender things are actually endocrine disruptors, which means they act like maybe estrogen on receptor sites. Also, there's some data out there possibly saying like these plastics in diapers that can cause some endocrine disruption and hormone imbalance, and that's really not good. So the best you can, if you can get more natural products, I know they're more expensive, or even trying to go old school and do the cloth. I've had a lot of patients that do that with the vinyl covers, trying to get those plastics, the chemicals off the babies, because it's starting to cause some problems they're noticing. So just be very safe. Try not to put anything, and yourself too, try not to put anything that's chemical in. In a couple months I'll talk about detox, my detox videos. Anything you put on your skin, it gets absorbed into your bloodstream, and it could be toxic sometimes. So there's a lot of things we need to talk about, the things we wash with, the plastics. We have a high level of plastics in our blood and now in our brains, they say. Just trying to say the paraffins, the pesticides. Look also, even if you're nursing, making sure that you're trying to research that. I think the environmental company that does the Clean 15 and the Dirty Dozen, the Clean 15, that's kind of coming out of what what vegetables and fruits that you should stay away from that are commercial. Make sure you eat organic if you can get it organic as best as possible, because they're just so covered with pesticides and they're just not worth it. Strawberries is number one forever, so just try to get, if you're going to do strawberries, try to do always organic. So start to think about these things when you're doing that, and also when you start to introduce foods to the babies, trying to stick with those organic ones and look at that list, because it's really important to stick with the healthy foods that don't have these pesticides. You know, think about how you're cleaning, using more natural cleaning products. There's several companies out there that do a great job and not have the chemicals. Also, you know, we have like the paraffins and formaldehyde. You know, we have the BPA and the BPA substitutes. Like, you know, like make sure you're like, if you're using canned foods, make sure that you're getting the BPA-free cans. Like trying to clean up that, because it does translate into our kids, and that they're more susceptible than we are as adults. But across the board, we're all getting toxic from these things. So this is a little another soapbox I'm going to stand on to pay attention to your environment with your babies too. The final thing too with that is candles, those Glade plug-ins or any of those synthetic plug-ins. Try to stick with maybe more than those natural oils, natural things when you're doing, like trying to cause good scents in your home, or just even put some cinnamon and clove in water and boil that if you want something more natural for smelling in your home. And so those are some suggestions there. This is a little testimony. This is, I don't know, a little bit old now, but yeah, this was one of my patients. I treat their family. Finally, one person, when the daughter came in, brought her daughter in because she wasn't pooping. So I'll read this. She kind of posts like 9 months old, almost skipped. Okay, it says, Nora has been a reflex baby her whole life because she didn't struggle to gain weight. The pediatrician didn't bother to care. After only 3 visits with our chiropractor, Nora is like a new baby. She is grown, she is more mobile, she wants to eat more, she's finally pooping regularly. She's always been such a happy baby, but it is truly a gift to see her start flourishing this way. She deserves to. If you're in the area, I beg you to go to see Dr. Rachel. Your whole family should, for real. We love her. So that is unsolicited. She put that on Facebook and she let me use this. It's really a blessing that I get to do what I get to do and help babies with these kind of things. I get these more often than I like to admit, but it's really nice to see these things happen and people thriving. I love what I do. I'm blessed what I do. This here is a picture of a family, and actually there's already another. I traded her from before she was married, through her pregnancies, and now she's got a family of 5. So they're just happy, healthy. She talks about how she testimonies how her pregnancies and her deliveries went great, and all she can think of is what she did different from her friends was this chiropractic. And then she likes to, I advise her on supplements and all lifestyle things. She says, relief, discomfort, better sleep, nervous system improvement, immune system improvement. Now, these kids are going to get sick because their immune systems are growing and developing, but like I said, maybe not as long as the other kids in their class. There's just other things that go on. But anyway, we can make our lives healthier, less stressful. I think that's a great thing. So come on in if you want those benefits. We're safe, we're gentle. I'm certified through ICPA. If you can go on there, I think it's ICPAforkids.org. If you're looking for a chiropractor, if you're not in my area that does pediatrics, that means they went through their program, intensive program. And if you want more information or more videos, you can go on my YouTube channel. It is Dr. Rachel Northern, DCCACCP, and my phone number, if you want to text her office for more questions or make an appointment, is 815-344-0113.